Ready.
Um, I have been toying with an idea for quite a while to how to bring the healthcare costs down, particularly in Bangladesh, because I have been associated with the healthcare of Bangladesh for the last 15 to 17 years. As you probably know, আপনারা জানেন, I will keep speaking in English because I'm comfortable with English more than Bangla because I have been away for over 50 years. And you see, the idea of mine is something that I want to share with you, is something that I'm going to tell you is not something that I discovered, but I had an opportunity to see firsthand a plan which Kaiser Foundation hospitals in California in the late 50s and early 60s and 70s, where I was working there as a gynecologist. The idea was that Kaiser Foundation, they were in the shipbuilding business in Northern California. And I was working for a hospital there called Best Kaiser Hospital, where they used to have a kind of plan, not an insurance, but a plan that $1 a day keep the doctor away. $1 a day keep the doctor away. And it worked so well with one hospital in California in the late 50s. Now they have over 500 hospitals in the United States, all for $1 a day keep the doctor away. And why I want to start in Bangladesh, because I was born there, that's my home, and I love going to Bangladesh. And although I have an international passport with European Union, but I do keep coming back to my home, back home, back home. And I feel that Bangladesh, being a very small nation with a very heavy population and large number of physicians and hospitals, but the total health care is not as well as one would like to see. There are some beautiful, very well-trained doctors in the nation, but somehow they're all on their own, they're all not organized, they're all working so hard to give their best, but unless you organize medical practice, it just doesn't work. One doctor is very good, one doctor is very bad, but in the field of medicine, if one can be a group doctors delivering the health care for a large number of people, working 10 to 5 daytime. And I would like to say that Bangladesh is the ideal country because of their demand on healthcare and their need. And being a nation with large number of NGO, non-governmental organization, with a heavy thrust on microcredit. Microcredit, which is, as you all are aware, was the brainchild of Professor Muhammad Yunus of Chittagong, now, of course, in Dhaka. And he's a kind of man that is world over, he's an icon in the world today. And he has created an institution which is called microcredit all over Bangladesh. And there is a captive population. That is, he has, as far as that Grameen Bank is concerned, they have 77 million or 70 million, I think 7 million microcredit borrowers which is a captive group that we can really work on, because it's impossible for us to go 1 taka a day. But I would like to say 1 taka a day can keep the healthcare going in a very nice way, because the doctor who will be working, the doctors who will be working for us will be a full-time employee, that they do not go for private practice, because they will have very highly paid doctors, more than what they get now, and they will be working at reasonable hours, like 9 to 5, and go after 5 o'clock. They go home. They go with their family. They look after their own. They have a life of their own. But now, what happens in Bangladesh, particularly, or in India, as a matter of fact, they all work till 9, 10, 11 o'clock in the morning, and I've been told some very successful doctors in Dhaka or Chittagong, they work till midnight, sometimes 1, 2 o'clock in the morning. I feel that's really not necessary. In other words, I would even like to go as far as to say it's insane to work such a long hours in the evening, not giving any time to their own families, their children. So I would like to say 1 taka a day keep the doctors away. And I feel it will be a very successful health plan. By the way, it's not a health insurance at all, because you don't get anything back for your money. What we do is to manage your total health for you and your family. Like a family of 4, for example, who is a microcredit borrower, initially I would like to stay with only the NGO microcredit borrowers, because we need to have the money, the healthcare to deliver the health plan in a group. It's impossible to collect 1 taka from one person. It's impossible. So a family of 4, say, pays 365 taka multiplied by 4 comes to 1,440, 1,440 for the entire family. And I've done some very good survey in the last few years that there is no family in Bangladesh that does not spend 1,440 in a year. Even a rickshawala, tangawala, dhawawala, all wallas, they spend at least 1,400 taka per year. So if this money comes to in the health plan kitty, multiplied by, say, 7 million, it becomes an enormous amount of sum which we can manage the total health care. I know the whole system, how it works, because it did work in California. Why shouldn't it work here? It will, because our people, as long as we can keep them healthy by giving their preventive health care and good public health, like in Bangladesh, is easier, because, as we know, for the last 20, 25 years, Bangladesh has been really doing very well in terms of public health. I understand there's no home in Bangladesh that doesn't have a toilet facilities, which is more than India can say. And the demand of healthcare can be controlled by employing our full-time doctor, because you don't have to go to a specialist on day one. You go through your own family practitioner. A family practitioner will screen the patients, and who needs major surgery, we refer them to our Dhaka headquarters or Chittagong headquarters. There are some excellent physicians in Bangladesh. There's no dearth of good doctors in Bangladesh, but it's just that you need to be organized. We will manage your healthcare. We are not going to say that we are giving everything you want, because as a patient, one does not know who to go to, where to go to, who will be the best doctor to go to. They will be managed by the band of family physicians first, and then if the family physicians check through, after that, if he refers them to our central office to say this guy needs a, or this lady needs a hysterectomy or lap chole or other laparoscopy. As you all know, these days our laparoscopic surgery has become a very successful way of treating major surgeries like gallbladder, hysterectomy, which we could not imagine doing that 20 years ago. Today we can. So the combination of microcredit and the referral for the central referral, we can take care of them from your cough and cold, ordinary medical illness. We can control the total health care from cough and cold to brain surgery to heart surgery, everything. Everything. Well, we are working very hard on this plan. Now very soon we will be going to the government of Bangladesh, to health first minister, to the general public. We will be coming to say that here we have got a plan that you can depend on us. You can depend on us. That's very important. But the common people, common people do not know where to go. Most of the patients I see in Bangladesh, they go straight to the specialists, which is not necessary. You should be going to your family practitioners who are well-trained family practitioners in Bangladesh. As you probably know, that the Bangabandhu Medical University has opened a program called Diploma in Family Medicine. That means it's a 3-year full-time course. They produce some excellent physicians who are specialists in all branches of medicine. And we shall be looking forward to working with them, and I hope the government will be interested. I'm sure they will. Only initial reaction is they are very interested because the healthcare problem, even in the United States of America or Britain, they find it very difficult to solve because, as you know, the American presidential election, when the election comes, they all say, we will take care of healthcare, we will take care of it, and then there's Obamacare and Clinton care and all kinds of care, but nothing works. Nothing has worked so far in the United States. We, as a Bangladeshi, we want to show the world that healthcare costs can be brought down and deliver a high-quality medical care. And I bet I will work with you. Thank you.